score is calculated by evaluating the baby on 5 criteria. Each criterion receives a score between 0, 1, or 2, depending on the observed condition. The values obtained from each is then summed up. The resulting APGAR score ranges from 0 to 10. The 5 criteria are appearance, pulse, grimace, activity, respiration. Appearance, or skin color. If the skin color appears blue, bluish-gray, or pale, the infant is scored 0 for color. If the body is pink, but the extremities, like the hands and feet, are blue, the infant is scored 1 for color. If the entire body appears normal and is pink, the infant scores 2 for color. Pulse, or heart rate. If there is no pulse, the infant scores 0 for pulse. If the pulse is less than 100 beats per minute, the infant is scored 1 for pulse. If the pulse is greater than 100 beats per minute, the infant is scored 2 for pulse. Grimace, or reflex response. How the baby responds to stimulation, like a mild pinch. If there is no response or reaction, the infant is scored 0 for grimace. If there is a facial movement only, the infant is scored 1 for grimace. If there is a cough, sneeze, cry, or pulling away, the infant is scored 2 for grimace. Activity, or muscle tone. If the muscles are loose and floppy, and no movement, the infant is scored 0 for activity. If the arms and legs are flexed with little movement, the infant is scored 1 for activity. If there is an active spontaneous movement, the infant is scored 2 for activity. Respiration, or breathing. If there is an absence of respiration, the infant is scored 0 for respiration. If the respirations are slow and irregular, with weak cry, the infant is scored 1 for respiration. If the respiration is normal with a good, strong cry, the infant is scored 2 for respiration. What does the score mean? The first APGAR score gives the health practitioners a clue in deciding if the baby needs immediate medical attention. A score between 7 and 10 is good and means that your baby is in good shape. If the score is between 4 and 6, it means that the baby may need help with breathing, such as suctioning the airways, massaging, or giving him oxygen to help such baby breathe better. If the score is 3 or less, the baby may need immediate resuscitative measures. However, a slightly low score is common in babies born prematurely, with complications